Alright, these are going to be the fixation scans. I'm going to start first by assessing neck extensors. That's going to be checking for a lumbar fixation. So patient, go ahead and look up if you would. And I'm going to push down, hold your head up there, hold. Good. Turn your head to the left. This is for a left SI fixation, hold. Good. Turn to the right. Right SI fixation, hold. Good. Bilateral weakness on the extensors to the right and to the left would indicate a sacral fixation. Next, I'm going to test for a CT junction fixation. I'm going to test the middle delt, so relax your arm right there. I'm going to push down this way, you hold there, hold. Good. And normally I would do this bilaterally. Bilateral weakness would indicate a fixation, but for the sake of time in the video, I'm just going to do one side. So that was for CT. Next is going to be for thoracic, so I'm going to assess teres major. So make a fist, put it in the small of your back, raise your elbow as much as you can, and hold. Good. Next is going to be for lumbar. We're going to do lower trap. So the patient's going to bring their arm here, hold here. I'm going to be pushing down, hold. Good. Relax. That was for lumbar. Next we're going to check for upper cervical. So I'm going to raise the patient's leg, instruct them to hold their leg here. I'm going to observe if they can first. Then I'm going to push down and instruct them to resist. Good. Relax. That was upper cervical. Lower cervical is going to be popliteus. So we're going to come here. Foot is flat. Internally rotate. I'm going to instruct the patient to hold there. I'm going to induce external rotation of the foot, observing for tibial shift. Relax. And go and roll over for me, please, patient. And for a lower, for an occiput, this is going to be a psoas, bilateral psoas weakness. So up, out, externally rotate. Hold there, I'm pushing down and out, patient's pushing up and in. Good. And my assigned fixation was an upper cervical fixation, so go ahead and roll back over, face down. This would be indicated by a bilateral weakness in the glute max muscle test. Step one is going to be to find the stack, so I'm just pushing A to P on my patient's TVPs, or articular pillars, just assessing for rotation. I'm going to find the top of the stack, and I'm going to try to induce rotation at that vertebral level in a theta to Z aspect. So if I find a right posterior TVP on the top of the stack and I try to induce rotation and it's not rotating clockwise, then that would tell me to start at the top of the stack and apply a syncopated adjustment there. If it wasn't rotating counterclockwise, then that would indicate that I would start at the bottom of the stack and apply a syncopated adjustment from there. And the rotational aspect would look something like that. And that is my fixation scan.